Hello and welcome to Lecture 4, where we're going to be talking about your business plan and your team. So what exactly is a business plan? Well, a business plan is pretty much a roadmap for success. Consider it that super important document, or what is called a foundational document, that will showcase who you are, what your product or service is, and the benefits it offers. But most importantly, it also has to include a description of how you plan to get from what and who you are today all the way to a successful, profitable enterprise. And there are many components in this document, but you can start with the basics, which we've talked about so far in this course. And let's say, for instance, a startup in the medical sciences that's aiming to develop a new diagnostic tool for early cancer detection, you would need a comprehensive plan that's going to outline what the technology is, its advantages over existing methods, and the market potential. That would be the beginning. And this is where you start to document your business plan. In, let's say, another example, you have a pharmaceutical startup that would outline a new drug's mechanism of action, its target indications, and its advantages over current treatment options. So the plan here would emphasize the drug efficacy, safety profiles of the drug, and market readiness for the drug. How about another example? A biotech startup developing portable DNA sequencing, for rapid diagnostics. Their business plan would detail, once again, technology capabilities, so tech heavy, its applications in the clinical settings, and the potential to revolutionize, let's say, patient care through quicker and more accurate diagnoses. Once again, you're going to need to start immediately thinking here about what's the market and how can we get this to work in the current market. So these are just the beginnings of your business plan. Now, an easy way to start planning to write your business plan is to consider it structured just like a research article. So much like a research article, a structured business plan is crucial and always challenging to write. So it organizes critical aspects systematically, ensuring clarity and coherence. A medical sciences startup business plan should unfold like a detailed scientific paper presenting market analysis, product specifics, financial forecasts, and all of that in a coherent structure. So what are the components of a business plan? So there's some flexibility here, and I don't want you to think that this is the only way you can do it. But certainly, each section in the business plan will hold significant weight. And for instance, in medical sciences startup, we would devote considerable attention to the market analysis, right? Looking at the competitive landscape, potential clients, customers, and not necessarily most importantly, but really importantly, regulatory hurdles. Additionally, in the product and services section of your business plan, there would need to be detailed descriptions of the technology's development stage and its life cycle. So looking at the components, we start off with an executive summary, which is somewhat like the abstract, which talks about the vision and mission statements. You then would have a market analysis section, which is looking at the target market, what's the competition, and your positioning in the market. Product and service line, you're going to have a description, of course, where you are, the development stage, and where you are in the life cycle, and what is the life cycle of what, the product that you or service that you're working with. Marketing and sales strategy is another section that is all about promotion, distribution, sales of your product slash service. Another important section is the financial projections. Definitely, if you have investors, this is what they're going to look at. What's the revenue? What's the profit? What are your cash flow forecasts? For your management of your company, you're going to have the operations plan. So what's the day-to-day business operations? And finally, what's your organization? So what's your management and organization? So you're going to have to look at legal structure, management team, the overall team, dev team, research team, all of that fun stuff comes together to build your business plan. As an example, let's say in the financial projections section, a medical device startup aiming to launch a novel imaging technology, for instance, would present anticipated revenues, manufacturing costs, and potential profit margins to, in early stages. That's what they would want to present to people, let's say, who are considering investment in their startup. So the first section is typically the executive summary, and the executive summary acts as a concise representation of the entire business plan. Now, for medical sciences startup, this summary would encapsulate the innovation, its market potential, and the team's expertise. Now, imagine it as a little bit of a trailer or teaser, right? Like those movie trailers, enticing investors or partners to delve deeper into the plan. So meaning that it's an invite into looking further, just like an abstract is to a research paper. You have to realize that most people won't get past the executive summary because they're going to read it and they'll say, it's not a fit for me, and they won't read it. Or they'll read it and go, oop, nope, I'm not taking that risk, and they'll move on. So what you want to do is you want to make sure your executive summary has enough information in it to provide a full picture of what you're doing. However, what you don't want to do is say so much and in complete detail that you stop them from moving forward. Because once someone moves forward into your business plan, the chances are better that they're going to appreciate what you're doing in its entirety, as opposed to just kind of a quick knee-jerk, nah, not for me. So keep that in mind when you're writing your executive summary. The next important section of the business plan is the product service line. This is where you detail all of your offered products and services. The purpose is to explain what your business offers, its development stage, and where it's at in the life cycle. And this is going to be product or service specific. So you can have a very mature, well-established company like Nestle, but they may have an early product under development. And if that's the case, then you have very mature products that Nestle has, and then you may have some new product lines that are coming on. Or in the case of a startup, typically they're going to have one product or one service, because it's just too difficult to be able to manage multiple product lines or service lines at the very beginning of a startup, because there's only so much time you can spend in your startup. There's only so much money you have for your startup, and so to have multiple products all at once is very unrealistic. Does it happen? Yeah, certainly. But my advice is, start with a single product idea and then expand once you have some success there. Unless you're really lucky and you get some really massive investment because it's just some crazy disruptive technology that you've thought up, then maybe. But if not, you're looking at a single product, single service for your single startup. And just keep that in mind, that some of these, when you read about business plans and stuff like that, they tend to be written for more mature companies that have a whole variety of products and services that they're offering. Now, for example, if you had a medical science startup that was developing a new gene therapy, you would need to detail its developmental stage, its clinical trial progress, so where you're at in clinical trial and validation, and the potential regulatory milestones, because you cannot sell your product until you have met regulatory approval, or you've not received, regulatory approval. And so those would be your regulatory milestones. How long is it going to take you to get that through that process and then be market ready to sell? right? And this clarity assures that investors that may be coming to support you in your startup, that they can understand your product viability and the market readiness. So the next section is market analysis, and this is essentially doing your homework. So it's understanding the market environment that your medical sciences startup is in. So for instance, a startup in regenerative medicine would need to analyze the current state of stem cell therapies, assess market demands, and then pinpoint areas for innovation and unmet needs. That's what the market analysis would provide it. On the other hand, a medical technology startup that's aiming to revolutionize remote patient monitoring would explore, for instance, market demands, importantly, regulatory requirements in order to use this, the technology, and the potential adoption barriers for their device among healthcare providers and patients. Now, how about a healthcare AI startup? Well, they would delve into data privacy regulations. That's a big one for them. Market acceptance, there's another huge one for AI. And the competitive landscape in order to position their predictive analytics tool. The next section to consider is your marketing and sales strategy. So by definition, strategies for promoting, distributing, and selling your product or your service is what goes into this section. The purpose, of course, is to outline how the business plan will reach and engage customers. For example, let's say we are working with a specialized novel technology platform, as we mentioned before. You would need to outline strategies on how you are going to engage healthcare providers, how you are going to promote patient adoption because it's telemedicine, and how you're going to secure partnerships, very key here, with medical institutions. So remember, marketing and sales are both integral components to a business strategy, but they both have distinct roles and objectives. Marketing primarily aims to create awareness, right? Generate that interest and establish a positive brand perception about your company, right? You're going broad here, right? It also involves a long-term strategic plan or activity, right? This is where you do your market research, you do advertising, you do branding, right? To build, the foundation for sales, right? Metrics for marketing success would be brand awareness, how much reach you have, how satisfied are your customers. Now, sales activities are more in your face immediate, and the focus is converting leads into customers, paying customers, right? Closing deals, meeting short-term revenue targets. So sales involves direct interactions with your potential customers, and you need to adapt the approach based on the individual needs. Metrics for sales success, right, is to look at revenue generated. What are the conversion rates, right, of your leads to opportunities to paying customers, right? The number of deals closed. Remember that the success of marketing lays down the groundwork for the success of sales, and this will ensure a balance between long-term brand building and the short-term revenue generation that a startup really, really depends on. So the next section is a big one, and it's your operations plan. By definition, it's just the details of the day-to-day business operations of your company. And the purpose, of course, is to explain how your business will run on a practical level. And that's all summed up in this lovely figure of the SOP, Standard Operating Procedure, which exists for everything you do in your company, or should do anyway. But in your operations, and this is not exhaustive, but some of the big areas you should consider start with your operational goals, right? Of course, so what's the goal? How will you operate? What are the goals of your operations? Who's going to do all the work? So the team structure from executive to management to staff, right? If you're not a 100% virtual company, you're going to have to think of facilities and equipment. So where will your production or manufacturing occur? Where will you provide services? Where will your staff reside? So you're going to have to manage that, right? So you need to put that in your operation plan. Importantly, if you're manufacturing or producing a product or doing research and development, you need suppliers, right? You need people that are going to provide you what you require in order to make your product or deliver or build or research your product. And so that would be a supply chain strategy, because what you don't want to have happen is you have, your full steam production and you have fantastic, massive orders coming in, everything's wonderful, and then you run out of a component that is required for the production, and then everything stops. That's really harsh on a startup. So you definitely need a supply chain strategy where you know where you're getting where your suppliers are. You may even have backup for your suppliers, and you have a really healthy relationship with them to make sure that you don't hit that as a bottleneck of running out of a widget or something that you need. Now, of course, now that you're producing, you're manufacturing, you're creating, developing, researching, whatever you're doing at that time in your life cycle, you're going to have a process for that. So the production and service process is important, where you're going to have to outline, the process, the step-by-step process involved in creating your product or delivering your service. And you're going to want to emphasize any proprietary methods or innovative approaches. So when you're doing all of that, you're going to naturally think as well, am I doing a good job? Is this process providing quality product? Well, you'll only know that if you have a quality assurance protocol in place. And this is where you're going to describe how your startup will ensure quality in products of services. And this is really important if you are working with a product or a service that comes under regulatory control. If that's the case, quality assurance is key to getting regulatory approval. So don't keep that in mind. Here's another section in your operations plan you have to consider: technology integration. So you need to identify all the tech platforms and systems that are essential for your smooth operation. You need to discuss in your plan how technology will be leveraged to enhance, efficiency and communication in your company, especially as you scale. So if there's only 2 of you in the company, well, efficiency is pretty clear, right? And communication is pretty clear. But what happens when you start scaling? You go to 10 to 25 to 60 to 100 employees. Wow. You're going to have to accommodate them all, and communication still needs to be very effective, but it becomes more difficult when you have more people. So that's something you will need to consider in your operations plan. Of course, in the world of medical sciences, you're going to have to consider regulatory compliance. So that's a whole section unto itself in the operations of how you're going to deal with the regulatory requirements for or the standards that apply to your operations, right? So a detailed plan for this is needed. Another component that's important is the risk mitigation strategy. So there are always risks to your company, and those are actually called business risks, and you need to make sure you identify them ahead of time so that you can be proactive in terms of measures and contingency plans in order to mitigate these risks. So example we just talked about was supply chain disruptions. Wow, that's a big one. How about equipment failures? There's another one, right? How about your product doing harm? Whoops, that's a problem, right? You need to be ready for that. Of course, you'd like to believe your product will never do harm, right? Of course not. But what if it does, right? You're going to have to think of that. Is what's the, how do you minimize that risk to your company, right? Now, once you have all that in place, you're also going to want to know how well you're doing. So that's your key performance indicator. So in your operations plan, you're going to want to define measurable KPIs related to your production output, your delivery times, your resource utilization, establishing benchmarks, right, for continuous improvement. You're going to want to do that. Of course, your timeline and milestones are going to be important, especially if you have investors. You're going to want to hit the market in a certain amount of time because you're worried about competition. So you can put that in your operations plan as well. Budget and financial projections we're going to talk about in another section, but they are important to consider, of course, and they're tightly linked to your operations plan, of course. And then the last thing, and as I said, this is not an exhaustive list for sure, but you're going to want to think of an emergency response or business continuity plan, right? People don't want to think of these things, but you do need to have a plan in place for handling emergencies, disruptions, unforeseen events, right? Just include like communication, right? So what are the strategies for communication? What are the contingency measures, right? What is the business continuity plan if something were to happen, right? This is really important if you're a really small company. If you're an extremely large company, well, there's redundancy built in, right? And there's a lot of people that can step up and take over. But if there's only 3 of you in the company and one of you falls ill and is not available for, let's say, 6 months, whoops, that's a big problem for your startup. So you're going to want to think about that. I mean, it's not something you want to think about, but you're going to have to put some kind of plan in place to decide, okay, who does what if, right? Even if it's a bit silly, like it's just not really reasonable, because it happens, right? Some startups, there's only 3 of you, and you're all key players in the startup. You still need to think about it just in case. That's it's prudent. Okay, the money section. Financial projections. So essentially, they're forecasts of revenue, profit, and cash flow, and the purpose is to show financial viability and potential growth for your business. And these financial projections will play a pivotal role in the success and sustainability of your startup by providing forward-looking roadmaps for the financial health of your company. Now, these projections offer a glimpse into the anticipated revenue, expenses, and cash flow, which helps entrepreneurs make informed decisions and set their goals. Now, for a startup, financial projections serve as a strategic planning tool, right? Aiding in resource allocation, investment planning, and risk management, which we just talked about, which is a big one. Now, additionally, these forecasts are also important for attracting investors, because startups, as we've talked about already, one of the big challenges is not running out of money before you are revenue positive, and so you want to attract investors that are going to help you with that. And having these forecasts help demonstrate a thorough understanding of the business, financial viability and the growth potential, which is what investors look for. Now, regularly revisiting and adjusting financial projections will enable startups to adapt to changing market conditions, right, which sadly fluctuate all the time, and navigate uncertainties and ensure or try and ensure financial stability. And this will give you a more resilient and scalable business model, which is what you not only are you looking for, but you have to have, right? In order to move from a startup to a scale up to a full corporation. Let's talk a little bit about management and organizations. So by definition, it's the information about the business's legal structure and management team. And of course, the purpose is to introduce the people behind the business and its organizational structure. The figure here, of course, shows the C-suite, which stands for Chief Executive Officer, Chief financial officer, chief marketing officer. I think you get it. That's what the C-suite represents. And, the corporate hierarchy, includes various leadership roles, and each with distinct responsibilities and levels of authority. So the C-suite officers are, by definition, officers of the corporation, and their responsibility are top-level executives, that make strategic decisions. They set the company direction, and they are ensuring organizational success. They all report directly to the board of directors and are accountable for the company's overall performance. Now, in terms of a hiring structure, the CEO reports directly to the board of directors, and the rest of the C-suite essentially report to the CEO, but they have some interaction with the board of directors, or can have interaction with the board of directors. Now, what are some of the other executives? So the vice presidents, the directors. So at the management level, directors at the management level, not the directors that sit on the board of directors. So there's a difference in directors here, okay? Now, these other executive roles report directly into the C-suite, and their responsibility is to operate a tier below the C-suite and are responsible for more specific functions such as, let's say, marketing, finance, operations, human resources, but they also play a crucial role in implementing the strategic vision of the company, which is set by the C-suite, and they tend to manage more day-to-day operations within their domains. The next level down are managers, and this would be considered middle management positions such as senior managers, managers, and supervisors. Their responsibility translate the company's strategic goals into something that's actionable, right? Overseeing teams and ensuring objectives are met. They focus on more efficient execution of the day-to-day tasks, resource management, team coordination, and they also act as a bridge between executives and frontline employees. Not the final, but the kind of the last tier of the managers is the team leaders, and these are below any type of management role, and they they'll have like a title of a team leader or project manager, and they are basically the frontline leaders, right? They are directly responsible for guiding and managing small teams of employees, and they play a hands-on role in day-to-day operations, and they ensure that tasks are are completed efficiently on time, right? And that team members are motivated. And team leaders report to managers and serve as a crucial link between management and the frontline staff yet again. So remember that C-suite are top-level executives responsible for overarching company strategy. Other executives oversee more specific functional areas. Managers translate strategy into operation plans. And then finally, team leaders directly supervise and guide, the frontline employees. And all of this together allows, hopefully, for an efficient decision-making and strategy implementation, for what you would hope is going to be smooth functioning of your company. So does there exist a visual for your business plan? Well, there does, and it's called the Business Model Canvas. And essentially it's used to effectively define your business concept or your business plan. And there are a couple of different flavors. On the right side here of the slide, you can see the external or customer facing plan or canvas. And on the left is for the internal or the business facing canvas. And you use these in order to provide a visual framework, right, for developing, describing, analyzing your business model. Now, the first step in the use of this type of a canvas is to understand the elements of the canvas. So what I would do is go through the 9 building blocks of the canvas, which are your customer segments, your value propositions, your channels, your customer relationships, your revenue streams, your key resources, key activities, key partnerships, and finally your cost structure. So just familiarize yourself with them. Do it a little bit at a time. Like pick a few, work with them, and then just add on the other elements as you progress through the canvas. Now, the second step would be to identify your customer segments. So define the specific groups of people or organizations your business aims to serve, right? Identify their needs, their preferences, and their characteristics. Then go on to define your value proposition. Now, we've talked about that already in this course, but clearly articulate the unique value your product or service provides to your target customers. Understand how your offering solves their problems or fulfills their needs. Then you're going to want to look at the channels. So design your channels. Determine the various ways you will reach and interact with your customers. This could include, let's say, online platforms, or physical stores, or partnerships, or direct sales. Then establish customer relationships. Describe the type of relationship you intend to establish with your customers. Something like personal assistance, automated services, community engagement, or other approaches. Next, specify your revenue streams. Outline how your business will generate revenue. This can include your direct sales, maybe subscriptions, licensing, advertising, or other creative income sources. Then identify key resources. List the essential assets and capabilities required to deliver your value proposition. How do you reach customers and maintain operations? Then you are into the key activities. So you want to highlight the key activities your business needs to perform exceptionally well in order to be successful. And this might include, of course, production, marketing, distribution, or other critical functions. And finally, you're going to want to look at some key partnerships, right? So identify your external organizations, your suppliers, your strategic alliances that can contribute to your business model success. Always consider both suppliers and partners that can complement your strengths. Now for the, cost structure, right? So you need to outline the fixed and variable costs associated with your business model. And these expenses could be related to operations, marketing, your technology, personnel, of course, and more. Now that most all is in your canvas, you're going to want to iterate and refine your canvas because it is a dynamic tool. You're going to want to regularly revisit it and make any changes that are necessary to ensure that it is in line with your strategy and market. Because the market changes, don't forget. Now, finally, you may also want to look at testing and validation. So meaning that once you have your canvas, maybe you can test your assumptions or your hypotheses by gathering feedback from, let's say, customers, stakeholders, and experts, and then validate your business model through this experimentation, right? So by using the business model canvas, entrepreneurs can create a comprehensive and easily understandable plan that, helps to visualize, communicate their business model. Now, hopefully, what this does is it encourages strategic thinking and also fosters adaptability in response to the market, which is always dynamic, right? It's always changing. Okay, let's have a little fun. Let's build a business plan. A very high level, short, quick, just for fun business plan. The idea is a finger prick blood test that gives you blood work results in 10 minutes on your smartphone. So press pause, develop the necessary sections for your business plan, and then come back to the lecture. Okay, we're back. So what sections do we need and what do we need to put in them? So we're not going to put full detail in here because, of course, that would take a lot of time. This is just a high-level overview. So in your executive summary, you're going to want to state, a brief overview of the finger prick blood test startup. You're going to want to highlight, the innovative solution that you've come up with of providing blood work results in 10 minutes on a smartphone, and what's the problem it's solving. So the problem, the solution, and then you're probably also going to want to put the jurisdiction. So where are you operating? Where is this going to work? In what, let's say province or country or, region that this would work in, because each region or jurisdiction may have slightly different possibilities for this kind of innovation. So that would be the executive summary. Then you move on to the business description. So provide a mission statement and a vision for the finger prick blood test service, right? You're going to want to give an overview of the technology and methodology used in the blood test. Then you move on to the next section, which is going to be your market analysis, right? So what's your target market? You'd want to include demographics and potential user base. What's the analysis of current market trends? What's the growth potential and the current competitive landscape? Does anybody else do something like this? Maybe there's a company that does it in 10 minutes, but it provides a printout. You can't get it on your cell phone. You have to go somewhere and give a little sample of blood, and then it gives it back like a reading in 10 minutes. Who knows? Then you're going to want to think, what are my products and services? So in this case, as I said, in startups, typically it's simple. You have one product. So in this case, you're going to provide a detailed description of the finger prick blood test service. Now, an explanation of how results are delivered on smartphone and potential additional features is going to be required here. Now we're moving on to technology and operations. You want to have a clear overview of the technology behind the blood test. You're going to want a description of the operational processes involved in conducting and delivering the test results. In this area here, this is operations, right? So you're going to want to give as much as possible about how the company is going to be able to provide this product/service, right? This is where you're going to include this. So how about marketing and sales? So what's your marketing strategy to promote this finger prick blood test service? What's the sales plan, including the pricing, the distribution channels, and the sales targets, right? Along with this, you'll have customer acquisition. So how do we identify the target audience and the user personas, so to speak, right? Customer acquisition strategy is going to be important, and you're going to want to describe these, including partnerships, possibly, and promotional activities. As we are in medical sciences, you're going to want to have a section on regulatory compliance. You need an explanation of the regulatory requirements for the finger prick blood test service. What are the plans for compliance and obtaining necessary approvals? Where are you at in this process? That's an important consideration that's going to be updated in your business plan. You're also going to want, of course, financial projections. So providing a detailed financial projection is going to inform people about what your expected revenue is, what your expected expenses are, and your cash flow. What's the break-even analysis and return on investment projections? That's going to be key if you're going to be thinking about bringing on investors. Do you have funding requirements? So that's an important one, because depending on where you are in your startup and the development and the life cycle, you're going to want to clearly describe startup costs and funding requirements. Then you're going to want to describe potential funding sources, including maybe investors, or better, grants and partnerships. Next, who's on the team? Introduce the founding team. Include their expertise and roles. Do you have an advisory board? I hope so. Who's on it? And what are the key partnerships that contribute to your startup? If you can, provide milestone and timeline. So what are the key milestones for the development, launch, and growth of this finger prick blood test service? What's the timeline for implementation and achievement of each milestone? Now, the less fun stuff, what are the risk and mitigations? Identify, potential risks associated with this business. What are the strategies and contingency plans to mitigate these risks? I mean, a finger prick blood test may unfortunately have some risks to not just the business, but also to your patient. What are those? How can you mitigate them? Now, forcibly, you're going to go through that if you go through regulatory. They're going to force you to do that. But still, include this in your business plan as well. What's the sustainability and the social impact of your innovation, of your product? Explain how the finger prick blood test service contributes to sustainability and social impact. What's the consideration for ethical, environmental aspects of your product? I mean, maybe it's a use once and throw away. Well, that has an environmental impact. You may want to consider that. And then, in conclusion, you're going to want to summarize the key points and unique value proposition, of course, of the finger prick blood test startup. Now, the business plan outline will provide a comprehensive framework for developing and launching, hopefully, your finger prick blood test service, and will deliver, rapid results for your business, right? So what you're looking for is to have your business plan provide you with what would hopefully be the quickest road to success, right? And then you can adapt and expand each section with more specific details in order to tailor the plan to, the unique characteristics of your business that are going to develop over time as you grow and as you figure out what's possible and what's not. And depending on, once again, as I said, in the jurisdiction you're in, it may take you down slightly different paths that you're hoping for in order to get to market. So you've had people come up to you and say, boy, that research that you've been doing is really interesting, and I wonder if there would be a way that you could, start up a business. And you think, what does that even mean? But then luckily, you've done a little homework, you've looked it up, you've gone to ChatGPT, you've taken my course, and you're thinking, you know what, I think maybe I am going to give this a go. So the next question is, who does this? Is it just you? Do you need other people? So what I'd like to talk about now is, what are the roles and responsibilities of a startup in the medical sciences that you should consider? And the order I'm going to give it to you is what I think is probably the order of priority, but it's my opinion, and other people may say differently. But first and foremost, of course, is the founder. It's you, right? That's the first person. That's the first role. Who's the founder? You can have a co-founder, of course. You have a good friend that's helping you out. That's great. So you're the founder. The next role is probably one and the same, but it's the scientist. So the reason for that is because there needs to be a lot of foundational research that goes into an innovation. That's how it starts, right? Is you need foundational research, and then you think, how can I apply this in the real world, right? And so that would be the innovation. So this can be a team of researchers or students. It can be just yourself, all up to you. But this stage, if you wish, which is the founder and the scientists, is the research phase and the research and development phase. And that can go on actually forever because you can get stuck. You never break out of that cycle. And that's the reason I'm giving this course, right? It's so that people, founders, students can realize that there needs to be a time when you need to decide, to continue the process of moving towards a successful startup. Because it's easy to get stuck in this constant iteration of improving your research and your technical ability. And you can get lost in it, right? Because you just keep saying, oh, it's not ready yet. It's not ready. It's not perfect. I can do better. And you just keep doing that forever, right? You do need at one point to just decide, okay, let's try and put this the way it is into a business model. And then you realize, oh my God, I get it. The business model is, how do I conceptualize moving my innovation into the real world as a business? And once you've done that, then of course, and you're working on it, you are still going to go back and improve your research and development, of course, your product. But now it's part of a business model. So in order to kind of move to the next stage in the business model, I would suggest someone in operations, right? Once again, it can be you again, but it's someone who's going to think of the process and the system of your business. This is, once again, a big step because you're going to have to think, basically, you're going to fill out your business model, right? And the operations is going to be, how do we run as a company, right? How do we take this innovation and actually make it available on the market as a company? So that's a big one. Once, of course, you have the I guess the framework for your business in place, and you guys are all excited. The next question that people are going to come up to you and say, oh, wow, look at you. You got a startup. It's fantastic. You have this innovation. Great. It sounds fantastic. I love it. I completely understand the problem that you're solving. This, you know how to produce it. You know how to manufacture it or whatever. You have a, minimum viable product. Everything's great. But then they're going to say, well, how do you make money? Who are you going to sell this to? Right? And so that would be the next role, is the marketing role, right? So looking into, how do you engage the client? Who is your client? Who's your customer? How are you going to brand? How are they going to find out who you are and believe in your company and trust your company? That's marketing. Next, of course, is sales, and that's going to be, how do you acquire your customers? How do you take a lead, turn it into an opportunity, and then into a sale, right? This is revenue generation. So marketing is more engaging your customer. Sales is actually generating revenue. Now, generally in a startup, your marketing and sales is going to be the same person, or it's going to be, something, it might even be you, right? But then eventually, once you start to generate a little revenue, or you've generated investment dollars because there is the idea that there's going to be a huge amount of revenue, then you're going to say, okay, well, I'm just tired of wearing all these hats. I'd like to hire someone to help me out, or hire a few people to help me out. And so then you need your human resources. And so the human resources is going to be, how do I look for the right talent? When do I hire? How do I hire? What's the best way? How do I minimize my risk to my company when I'm hiring? That's going to be HR. Now, finally, and I'm not saying it's necessarily always the last thing, but you're going to want someone who's going to help you with the finances of your company. Now, at this point, let me make the difference between accounting and finance, because accounting should have already been occurring all along. All right. And so accounting primarily concerns recording, classifying, interpreting financial transactions. It focuses on providing accurate and timely financial information for both internal and external stakeholders of your company. You have to prepare financial statements. You have to manage payroll if you're at that stage. You have to ensure compliance with all financial regulations. That's accounting, and taxes, of course. So you have to have that already going on as soon as you've incorporated, as soon as you have revenue coming in the door. You're going to have to do accounting. Now, finance, on the other hand, focuses on managing money, so investments, financial resources to optimize your profitability and financial stability. It involves strategic planning, decision making, risk management in order to achieve your organizational goals. So this is what deals with, for instance, budgeting, forecasting, investment analysis, capital structure. That's the difference between accounting and finance. And so having someone help you with the finance tends to be a little later, because in your startup you may not be in a position to have to, manage money, right? You're just paying bills and you don't really have revenue coming in, or you have a little bit of investment that came in and it's paying off bills and paying salaries. So that tends to be more on the accounting side. The financial side of it comes a little later. And very often the financial side will be covered by the CEO or be covered by you, the founder, to begin with. And you can get help. So if you don't know anything about finance, you don't have to say, oh my God, I have to go learn all that. No. You can get help through an accelerator or an incubator. And that's the first thing that, you can ask for. Hey, I need a mentor and I'd like to talk about finance. And that's pretty easy enough to do. And then of course you eventually, as you grow, you'll want to hire someone. When building your team, focus on diversity. Diversity in a startup team fosters innovation. A medical sciences startup aiming to revolutionize healthcare will benefit from diversity in the expertise, the cultural backgrounds, and very importantly, the lived experiences. And this will ensure a multidimensional approach to problem solving. And you can imagine, as a startup, you're going to be doing lots of problem solving. So when you build your team, make sure you don't look for clones of yourself. Though you may think you're great and you had the great idea, that's fantastic, but that's not going to necessarily help you in building your startup. Also, when you're bringing members on, there's no rush to build your team. Think long and hard, because you may end up spending a lot of time with these team members, and you may be going through some very difficult times with these team members, so you want to choose them wisely. What you can do in while you're waiting to bring on formally team members is you can reach out to friends and colleagues and people and mentors and programs that are going to help you along the way, but you're not necessarily bringing them on as team members yet. And this will help you. So especially when you want diverse opinions about, what you're doing, how you're doing it, getting some feedback, you can just talk to people and ask them, if you have, obviously people that are friendly with you, that are willing to just share with you, what their thoughts and maybe assist you a little bit. And you don't necessarily have to bring them on as team members. And very often they don't want to be a team member. They don't want to be part or tied to a startup, but they really do enjoy talking about what you're doing and being involved in innovation that way. And you'll be surprised at the goodwill that's out there that people will share with you because they think it's really cool and they like your idea, but they're just not into the responsibility of being part of the startup. And so you can benefit from that a lot, and you can maintain it. So you have your team, your inner circle, you're building your startup, but you still have a huge network of people that are willing to speak with you and collaborate with you. And you take them out to lunch, or you take them for a coffee, and you discuss it even once a month or once a quarter, right? All of that will be helpful for you in putting together your startup team. Let's talk a little bit more about what we mean when we say a diverse team. So the importance of cross-functionality in the medical sciences implies that we want to blend experience from scientific research and medical research, of course, but we want to blend it with business management and industry experience. For example, a biopharma startup may include scientists collaborating with business strategists in order to streamline the drug development process and commercialization strategies. So when you're looking at your team, you're going to want to, of course, look for, PhDs in terms of research, MDs or clinician scientists, so MD, PhDs. But you're also going to want to look for possibly, MBA and or equivalent experience, right? And then you're going to want to have industry specific experience if you can, if you can get a hand on it. It's not easy because inevitably to hire someone that has 15 years or to collaborate or partner with someone that has 15 years experience in the industry, they may be out of reach for you in a startup. So there's the tricky bit is how do you build this team with cross functionality? So even an MBA, if you hire somebody or if you're looking or to partner with somebody that has, business experience with an MBA and they're very good at what they do, they may they may not want to be working for a very small startup. They may be looking for the big job with the big salary. And so it's not easy to find these people. It tends to be a little bit easier to find the scientific research, medical research angle because generally that's who you are and that's who I'm teaching to, right? So, inevitably you're a graduate student in IMS or in a related field. And so it's probably easier when you are looking for, partners in the research and development aspect. But the business part is the tough part. And that's where you're going to have to spend a little time looking for that combination of business management experience, industry experience, and someone who's interested in what you're doing and believes in what you're doing so that they come on board and help you out in your endeavor. Okay, let's talk a little bit about team characteristics. As you can all imagine, effective teams prioritize clear roles, seamless communication, or what I call happy communication, swift decision making, and finally, alignment with common goals. Does this sound idealistic? Yes, absolutely. But it's what you should be striving for when you're building your team. For instance, a medical science startup would look to improve and have effective communication between scientists and business experts because this is what is going to help everyone understand project requirements, which leads to fostering the innovation of your company, and most importantly, productivity. If you have the two, I don't even want to say two sides or the two halves, but I'm gonna call it, the two parts of your company. One being the science research development and the other being the business aspect of your company. If you have these two parts that are not in sync, then ultimately what happens is you have a loss of productivity. And you can't afford that as a new young startup. You have to work efficiently and you are effectively on a timeline. You may think, oh, nah, I can do whatever I want. The only thing is the market's not going to wait for you. So if you really do have an innovative product, probably there's other people that have the capacity, have the ability to do the same as you. And so what you don't want to have happen is by the time you're ready, somebody's already done it. Now, unless you're absolutely certain that no one else can do this, no one else will do this, then sure, take your time. But that's quite a rare situation to be in. So generally, that's what you want to look for in order to drive efficiency and productivity. What is the importance of strategy? Well, strategic planning aligns a startup's mission and values with addressing challenges like research and development costs, regulatory barriers, and capital requirements. These are the three big ones for startups in general. Now, when you're working with your startup, what you ultimately want to do is develop a strategy that's going to differentiate yourself, your startup, in what's generally in the medical sciences a very crowded and competitive market. So what you search for is barriers and facilitators. So you're actually looking to see what's going to stop you from moving forward. And you're at the same time looking for what's going to move you forward. And based on those findings, you're going to put together a strategy that's going to get you to where you want to go, which will benefit your stakeholder value. In this lecture, we're talking about your business plan and your team. And it is no surprise that your team is going to have to perform a market analysis in order to understand your position in the market. And this is something that's going to have to be done iteratively. There's no end to it because you want to make sure you stay on track. And so in order to do your market analysis, you're going to have to basically jot down a list of your strengths and weaknesses compared to your competitors. But this figure here gives you a nice little overview of all the components required in the market analysis, many of which we've already talked about, like the market share, the market size, the market segments, who are your competitors, what's your customer mix, your competition influence means, do you have competition that's going to I guess force you down a different path than you had thought of. For instance, if you have no competition, you can do whatever you want, however you want, and put it out in the market, right? But if you do have competition, you may say, well, this other company, this other competitor of ours does something very similar, and they're really good at this aspect. Well, maybe what if we were to tweak our product just a little bit, our offering, so that we're not in direct competition with that other company. That would be your competition influence. The last one's your spending group. What's your product group? Like who are you selling to? Is it games? Is it entertainment? Is it healthcare? Is it products or what products, what services make up your spending group? And understanding that group is important because you understand that this is let's say it's for entertainment, right? You're going to understand that this consumer is spending out of a want as opposed to a need. But then by doing so, you can then look at other products in that spending group and say, what do we have in common with those other products, and what are they doing to be so successful in the market? And then you can learn from that. So that's the importance for looking at that. So once you've done your market analysis, of course, then you can start or put this into your business plan or strategy in order to be successful as a startup. Now, when doing your market analysis, there's something called the Porter's 5 Forces that can help you out. Now, the 5 Forces model was created by the Harvard Business School professor Michael Porter in the late 1970s. Now, since then, this model is probably one of the most popular business strategy tools that organizations use to understand more about the main competitive forces in their industry. Now, as listed here on the slide, there are 5 forces: the competitive rivalry, which of course, no surprise, that's who's in the market with you, who's a direct competition, who's not, how many, The next one is the supplier power. So inevitably, if you're creating a product, you need, components in order to put that product together, and they come from your supplier. It can also be services, for instance, like let's say something you do, you need, a supplier of a certain service in order to complete your product. Well, if they have power, what it means is that there's fewer of them, and because of it, they have the ability to up the price of what they do or the components they're selling, and that would put your startup at risk because that then all of a sudden it eats into your profits. So that's called supplier power. Buyer power is going to be in the hands of your consumer client, meaning what if there are very few buyers and a lot of suppliers? Then, sorry, not suppliers, a lot of you companies supplying the product, then that's called buyer power, because the supply and demand is such that there's a lot of supply and not enough demand, and so they are in power, right? So the buyer is in in control in terms of the market. The threat of substitution is kind of once again in the customer or the client's hands, and it's where they can say, well, you know what, your product is really cool and amazing, but it's a little bit expensive, and you know what, there's another way I can get the same job done. And so then they're substituting your product for something else. And finally, the threat of new entry, of course. I mean, if the barrier to get into the market is extremely low, then what's going to happen is if you have this wonderfully successful startup and everything's fantastic, but there's a very low barrier to get into the market, then you have what's called threat of new entry. You have another company or even multiple companies that are all going to enter the market, and then you have to share the market with them. If it's an enormous market, then whatever, everyone's happy, right? But if it's not, then what happens is you gain these competitors that you didn't plan for, let's say, and that's going to impact the operations of your company, and most importantly, the profit margin in the end. When it comes to regulatory strategy, you're only going to have to worry about it if your product requires regulatory approval. And this is going to happen if your product is in the medical space, it is either diagnostic, or it is involved in the treatment of patients, or it comes in contact with patients, or it can potentially harm patients. And if that's the case, what I strongly recommend is you phone a friend, find someone who has had experience in the regulatory space. You can even hire a consultant. And then what you do is you put together a plan, a strategy in order to achieve regulatory status or approval. And in Canada, of course, that's with Health Canada. In the United States, it's the FDA. In Europe, it's the MDR. So it exists in all jurisdictions, and it is definitely one of the biggest challenges for startups in our space, in the medical sciences space. And it can be very tricky, and it can take a long time depending on the level of regulatory approval that you require. It can take easy years, 2 to 5 years, minimum. Once you have the product and you're going through validation and writing it up, it can take 2 to 5 years. So this is definitely something that you're going to want to spend a little time on in putting together as a strategy. Finally, you're going to need a financial strategy. Now, depending on where your startup is in its life cycle, it will either be very simple or very complex. But essentially, you're going to be answering 3 big questions. Where do you get your funding in order to operate your startup and support it? Where is the money that you do have being spent, and are you spending it in the right place and at the right cadence, which is also called your burn rate? And how will you generate revenue? So, interestingly, whenever you talk to startup founders or new startups, what they talk about a lot is, how do we get investment dollars? Where are we going to get investment dollars? Where do we find investors? How do we get in front of investors? How do we pitch to investors? That's great, but you realize that whenever you bring on investors, you have to give up equity in exchange for their money, which means in a sense you're giving up a part of the ownership of your company and power, which is a huge risk, because investors are only investing to make money. They're not investing to make you happy, right? They're investing because they want return on their dollars. So really what you should be doing, first and foremost, is figuring out a way to get to revenue as early as possible, because then you're self-funding. If you have revenue coming in the door, then you can fund your company, the company's growth, and maybe the completion or the production or the creation, of new products. So early revenue is the best approach. Then if you need a little bit more in order to scale really fast, get into market really quickly and in a big way, then you get investment dollars to pay for that, for that huge scaling of your company. That's ideal. Unfortunately, in the medical sciences, that's also not common because there is a huge need of money up front in medical sciences because the product you're creating requires a lot of time and a lot of expertise and a lot of money in order to get it to what's called regulatory approval, which you can't sell until you get regulatory approval. So that's a huge barrier in the medical sciences, and that's one of the reasons that very often startups in the medical sciences will, by necessity, need to look for investment. Are there ways around it? There are certainly, where you can start selling, for instance, as an unregulated product. So meaning that it's let's say it's a wellness product, right? So if there's a way that you can minimize the claims of what your product does to be non-medical, so non-diagnostic, non-treating, and it's a wellness product, and then you put it out there and you make some money. And then as you're making money and you're establishing yourself in the market, you're slowly validating your product for the medical aspect of it, for regulatory approval. And then you go through regulatory approval, and then boom, you can now sell to, a broader or a different segment in your market where once it was wellness and now it's a medical device. So there's an example of where that can happen and where that would be a wonderful strategy, because then you're minimizing your need for investment upfront. In any case, we're going to talk all about that in our next lecture. Well, that brings us to the end of lecture 4. I hope you enjoyed it. I will see you in the next lecture, and we're going to be talking about funding and money.